find a mentor. And I don't
Yeah.
mean, so like people associate a mentor with like, this is someone that's just going to tell me what to do and they're going to be my coach. And no, I don't mean that, because no, people don't really have time for that. I
Yeah.
mean someone that you can just talk to and feel inspired by,
Mhm.
right? Like my PDA faculty, people that are now my friends that we talk to. Um, just find someone who you aspire to be, strike up a friendship with them and remain connected to them. And in the moments of doubt and in the moments where you're like, this has gotten really gritty and really hard, and I'm doubting my choices, reach out to them and see what they have to say.
This is Growth in Dentistry, a dental intelligence podcast, where we ask the question, what does growth in dentistry mean to you? I'm Steve Jensen, a dated dental nerd and your host. Welcome everyone to another Growth in Dentistry episode. I am super excited for our guest today. Today, we are doing another deep dive episode. These are some of my favorites because we jump on with practice owners, clinicians, team members, and hear their stories. And by the way, in order to get on these episodes, these have to be like top performing practices, at least in a few metrics. And our guest today is going to be in almost every metric, a top performing practice with incredible clinicians. And I'll introduce her in just a second. Before I jump into our guest today, as always, huge shout out to the DI marketing team for sponsoring this podcast. It's a huge effort to put this on week after week. And I'm so grateful for the work that they do. They have a special offer for all of our podcast listeners where you'll get a $50 gift certificate just for taking a demo with Dental Intelligence. And if it's been a while, if you've checked it out in the past and it's been a minute, definitely check it out. There's new releases happening every month. For example, right now we have a cool new scorecard that just came out that helps you track all of your referral sources and some of your marketing spend and where it's going. That's super awesome. We're also currently working on, by the time this gets released, it might be out already, an insurance analysis scorecard that a lot of folks are interested, especially coming into the new year, understanding by payer, how are things going, how much revenue is getting generated from those, as well as some breakdown on like annual patient value and things like that that are helpful. So those are coming out. It's been a while. Check it out. Definitely worth your time. Now, without any further ado, I want to introduce our guest today. So I have on the podcast with us Dr. Maggie Augustyn. Dr. Maggie went to University of Illinois in Chicago. She's been out of dental school for 20 years, which is a big deal. Okay, it's
That's
a
a long
long
time.
time, a lot of time to learn. So I'm excited to learn from you, Doc. She is a member of the AGD. Not just that, but she just recently was put in as, or is about to be, international spokesperson for the AGD, which is
Just
exciting. So
finished my training with them. Yep.
which is very exciting. She also is a fellow in the International Congress of Oral Implantologists. I hope I said that right. We
You
joke
did.
that
Thank
if you
you.
take all those letters, it spells out dental geek. Not really,
Yes.
but she's certainly a fan of the field. And even though she's been out of school for 20 years, what I love about her is she's clearly a student of her craft, and learning has not stopped, has continued to better herself as a clinician and as a dental professional, and is just finishing / has finished, is about to be FAGD as well with the Academy of General Dentistry. So super, super excited to have you. I will comment as well, Dr. Maggie, this might make you feel uncomfortable, but just so folks know, like what got Dr. Maggie on this podcast. And there's a few numbers that I personally love. A couple of my absolute favorite metrics are annual patient value. Annual patient value is a simple number. It's just total collections divided by the number of active patients. And Dr. Maggie and her team are in the top 10% of dental practices across the whole country in annual patient value. The reason why I love this specific metric is it tells a more complex story about the full patient experience. In order for that number to be high, patients have to consistently come back to the business. So as you would imagine, they're top performers in patient retention. Patients like them. Also, in order to be a top performer in that number, patients have to say yes to treatment. So as you can imagine, they are excellent at case acceptance. And then one other thing that's quite interesting is it's pretty obvious in how much dentistry they're presenting that they do more comprehensive work in their practice. So Dr. Maggie, I'll ask you kind of some questions around size of the business, right now. But before we jump into that, welcome to the show.
Thank you.
Give us a little background on like how you got into dentistry, and then we'll jump in, talk mechanics of the business a little bit.
Thank you. There's nothing romantic about my story. I did not intend to be, I did not intend to be a dentist. I loved science and I wanted to be a scientist. My dad is a PhD in organic chemistry, and I wanted to follow those footsteps.
Mhm.
But at the time, women didn't really have a place and they weren't heard. And he didn't see women being taken seriously as PhDs. And if I wanted to have a family, that was going to be very difficult. My parents, you'll hear my parents referred to as very often, they were a very important driving force in what I ended up doing. They didn't think I could deal with death very well, so they didn't think being a physician was a great choice for me. And I loved working with my hands. I was an artist early in my life and have been throughout my life on and off. And so dentistry just seemed like a really great culmination of all of my talents. And I didn't have to take physics on the DAT in order to enter dental school. And I didn't like physics. I didn't understand physics. And so ended up pursuing dental school. When I entered dental school, I didn't know what a crown was. I didn't know what a bridge was. I didn't know what a root canal was. And I just found myself in this place, but I loved learning and I
Mhm.
loved working in my hand with my hands. And so I just fell in it and was extremely lucky to have also fallen in love with it right from the beginning.
Mhm. Yeah, that's actually like so fascinating and very pragmatic. You and Adam would get along really well. That's how he behaves in his life. It's like, what makes sense? What's
What makes
logical? Let's
sense?
just take the path and run with it. Um, so I'm interested. So you graduated from dental school, and what has your career history been? Just so we can kind of outline that for listeners. Were you an associate at all right out of school?
I
What did
was,
you
and
jump
I wonder
into
if Adam
practice
is the same
ownership? Yeah.
way. I am not a person that has a poker face, and I am not a person that likes to keep her feelings to herself or her opinions to herself. So I did not have successful associateships. I went through one associateships, ended up being let go because I thought I was better than everybody else. I was immature. I ended up going into a second associateship. Now, this was 19 years ago when DSOs weren't what they were, but they were practicing in a very unethical way. I was outspoken. There was no place for me there. And with two broken associateships, the only option I had was to open a place of my own, but I was so scared to do it because of the financial strain. So I
Yep.
talked to almost everyone I knew, and everyone said no because we had just graduated from dental school. This was maybe 18 months after graduation. And there was this one guy that I worked with at the DSO, and he was the last person I asked. And I said, hey, do you want to go into business together? And he said yes. And so the two of us opened what is now Happy Tooth in Elmhurst, Illinois. And we took over um, an an HMO practice that was open 2 days a week, and we expanded it for two doctors to 5 days a week. But it was still predominantly an HMO and public aid office until 2020. Up until 2020, we were paid $58 for a surgical extraction. We were
Oh my
paid
God.
$235 for a crown. And that's with the public aid office through, and for the HMO, we would be reimbursed less than $500 per unit. I'd
Mhm.
be paid between $200 and $400 for molar endo. Um, so to hear you say these things
Yeah.
about us today is really wild.
Mhm.
And it really shows the distance that not just me, but my team and everybody along the way has traveled to get us to this point. But yeah, we started the practice 18 years ago. We started Happy Tooth.
And then tell me, like, let's just so listeners can kind of hear. I think it's helpful to understand, so is how many doctors, well, maybe start with ops and then do like kind of team sizing, doctors, hygienists.
At this time, we have 7 ops. We
Okay.
have 2 doctors and 1 associate. The associate works only 2.5 days. I don't know if we will always have an associate. We've had an associate and we haven't had an
Okay.
associate, so kind of ebbs and flows. We have 2 hygienists. One of the hygienists by choice. I want to stress that by choice
Mhm.
is doing accelerated hygiene, and it tends to work really well with her hands and in her hands.
And
We
I'm allowed
have
to ask this, is the choice because there's a comp model that they prefer, or they just like working fast and busy and want to just help a ton of
so
people and flow them through?
So it started because one of our hygienists was out for surgery,
Hmm.
and we didn't just require her to do that. We paid her quite a bit of money and
Hmm.
asked her to do that. And we gave her an assistant to do that also, and she liked it. And when the other hygienist came back, we gave her a choice. Do you want to continue doing assisted hygiene, or do you want to go back to the way
Yeah,
things were? And she chose to do assisted hygiene, and
cool.
she's been choosing to do that. So she likes doing it this way. She gets to talk to patients and scale them and probe them, and everything else is done with the assistant. So there's a lot of pros and cons to that. And any moment she decides she doesn't want to do that anymore, she goes back to doing it the way that we had been doing it prior. So 7 ops. Now, this is a
Which, hey,
question
I'll
that
say something too. One thing that's just cool to note is one of the numbers we track is perio percentage. And the hygiene team at the practice is actually, in terms of like perio compliance, is right in that top 10% of performing hygiene teams. So even with this accelerated hygiene arm that's happening, patients are still getting diagnosed with perio, and that's being treated within the team, which is actually really cool to see. That's a piece of context I didn't have coming into this. So, the team's providing great care to the patient still, which I love.
Thank you. I know one of the questions that gets asked very often is, what is the ratio of assistants to doctors? And
Mm.
my answer is never. That has nothing to do with the doctor. It has to do with your chairs, because I have one assistant per chair. And I can't imagine having 3 chairs that I'm running with less than 3 assistants. I
Mm.
don't see how that's fair to the assistant. I don't see how that's fair to the patient. I don't see how that's fair to me. I don't see how that's fair to the admin team. And so if we are running 4 chairs, so we have 3 hygiene chairs. So we have
Mhm.
those 2 hygienists and one assistant on one side of the office. And then we have sometimes 3 production chairs and 1 hygiene chair, sometimes 2 production chairs and 2 hygiene chairs, depending on the day. But we have an assistant for every single room in there.
Sweet.
So we have 5 dental assistants at all times.
Okay, that's super helpful. Any other practice sizing questions that are helpful?
No, I think that
Maybe some equipment stuff people are always interested. I'm always interested. Like your case acceptance is good. Do you guys do intraoral scans? Are you doing, like from like just like a operations flow? Is that something that's consistent in your business?
That is something that I really want to start doing. So I don't know if I'm allowed to say this, but we do have 2 Dandy scanners, and I really like Dandy. The reason why I'm saying that is because it allowed me to try out the technology without having to pay for the equipment. We
Hmm.
also have a Trio scanner that is ours. We just bought a mill and we're trading on it at
Okay.
the end of the month. And we bought another scanner, and we have a CBCT scanner. And I just bought a printer that's going to be able to print dentures and surgical guides and all kinds of stuff. So I am super thrilled to have all of this technology around me. And I think by maybe March, we're just going to be next level when it comes to that. And you should see patients' eyes light up when I
Hmm.
start to talk to them. You're not going to have to come back. We're going to be able to give you that crown in about an hour, hour and a half from when I start.
See, I'm like I just finished my taxes, so I'm listening to you talk about all this new equipment you bought, and I'm like, sounds like an
Yeah.
accountant saying, "Hey, this is a good
Yeah.
year. We need to depreciate some
Yep.
stuff to offset some of our tax liability quick." But yeah, that's exciting to be investing in technology as well. Okay, so that's helpful, kind of just to like size up the business. What do operatories look like? Team size.
so
Go ahead.
treatment mix. You're placing
Oh yeah,
three
that as well.
implants. Sounds like you're doing some aligners. Uh, what things do you refer anything out, or do you keep most everything in house?
So one thing to keep in mind, our growth happened between 2020 to now.
Okay.
I've only started doing my implant journey essentially last year and a half. So
Okay.
before that, so implants have really been hot and heavy over the last 18 months. I have always done molar endo. I am steering away from upper molars when it comes to molar endo. I don't have a scope. I prefer to do implants rather than learning to find that tricky, and I could call it other terms too, MB2. Um, And I don't do full mouth rehabs. I do not touch anything cosmetic. It's just,
Cool.
that's not something that I ever want to deal with. So molar endo, implants, my partner does aligner therapy. What else is on there, on the agenda there? Bone grafts. I love surgery, extractions, almost any extraction except full bony. I don't do that.
That's great. Yeah, in fact, that's like very interesting to hear. I would have guessed there was some more of like the cosmetic, crown and bridge.
Yeah, sure.
Okay, so
Crown and
that
bridge.
kind of stuff is happening. Okay. So let's go ahead and jump into stories. So I think a lot of folks, the ADA did a bunch of surveying this last year around insurance relationships specifically. And it was like half of the dentists said in 2024, they intend to change their relationship with at least one of their insurance plans. So that's like obviously like a big topic of like switching. I just did a webinar this last week and I polled the audience and it was like 83% of the audience, there were a couple hundred dentists, had gone out of network with one of their plans. So I'm interested to hear kind of the stories. You had 2020 is when like the growth really started. You were like heavy HMO. I would love to hear, Maggie, if you don't mind, we'll kind of just like be quiet for a minute. Kind of talk us through 2020 to 2024 and the change, because it sounds like maybe if we would have had this interview in 2020, I probably wouldn't have been saying like annual patient value is really high and
No, yeah.
treatment acceptance is really high. Like it may have been a different podcast episode. It would have been like, hey, how do we change things and make a plan for the future? So I'm interested. I'll shut my mouth. I'll let you kind of talk us through the transformations you've been over in the last 4 years.
I'll tell you, I think a really important reason for which we went to being able to drop HMO and public aid had to do with COVID, because all of a sudden we were thrown in this place where we didn't have a lot of team members, a lot of people left. We didn't have a lot of space or time. We needed to start seeing patients again. There wasn't a ton of availability, so we had to become more picky about who we were seeing. So one of the first things that needed to happen is we ended up stopping seeing public aid patients. And it was somewhat heartbreaking because that was one of the things that were important to our core values. We wanted to be able to provide treatment for as many patients as we could, but we were only given so much to work with. So that was one of the first things that we did. And then again, we didn't have a hygienist for many months after COVID. So how could we have been able to see HMO patients? Now, I don't know if you're familiar with how HMO works, but you get $0 for every pro fee. So how could we have possibly been able to pay rent and pay our team members if we were going to see patients for nothing when we had a long list of patients who wanted to get in? Now, we were in Illinois, so we were forced to be closed down for probably about 14 weeks, right? So we had a backlog of patients that wanted to get in. So we made the decision that we were going to start going out of network with the HMO. We had already dropped the public aid patients, and then we also renegotiated our fees. So with the PPO, with our PPO networks. And so that put us in an entirely different ballgame. Okay, so that was one of the first steps that we did. So we were still in network, we were still insurance driven, but now all of a sudden we went from being paid $235 for a crown or $400 for a crown with the HMO to being paid $600 or $800 for a crown, right? So then without really doing anything, you're almost doubling your production.
Yep.
So that was one of the first things that happened. And that you could say is pretty easy. Okay, that was easy to do.
And timeline, how long did that take? Was that like 2020 by the end of the year?
Well, no, because the insurance negotiation takes time.
Yeah.
And we did that with PPO profits. And so I don't know, that negotiation might have taken 18 months, maybe 12 months, something around that time, right? So, but that wasn't the easy part. The much harder part was when we hired a consultant, and that was Productive Dentist Academy. And I know you're very familiar with them, and we've been working with them for 4 years. And that is when we had to go from being a practice that had a revolving door, where I could literally hang up on a patient because they were bothering me after hours and not blink twice, right? Because there were so many of them calling me, into now welcoming and caring for these patients because we cared for them and because they wanted to be there, as opposed to like, we can't wait to shut the doors because we can't see you guys anymore. There's too many of you, you know, and the dynamics between what the patients were like back then and what they are like now has also significantly changed. So we needed to undergo this incredible, I don't know if you can call it a brand, 180-degree turn of literally just having 20 minutes for a crown prep, 3.5 minutes for an exam, into taking 15, 20, 30 minutes for an exam, into prioritizing relationships. You know, now I use 5X loops. I spend, you know, I would have taken pride into saying, yeah, I can prep a crown in 5 minutes and 3 minutes, and I still can.
Yeah.
But I choose not to. I mean, now it'll take me 15 minutes to prep a crown because I'll slow down the speed on my handpiece and I'll go in there because I want my margins to look like they're going to be picture perfect. You know, that's just how I am now. So it's really taken a lot to it wasn't just fee negotiation. It wasn't just that. It was really, but then it also was educating the patients on their oral health. You know, we're not just talking about, oh, you come in with a broken tooth, we're going to put a crown on it. It was, hey, Mr. Jones, you got all these cracks in your teeth. Do you want to keep your teeth for the rest of your life? Oh, yeah, I do. Well, then you know what? Let's make sure you do that. And we're not just going to fix one tooth, we're going to fix all of them. And every now and again, it still comes up where a patient will come up to me and they'll try and make me pick. They'll try and make me pick, hey, which crown is most important? And I don't let myself be manipulated like that anymore. I said, look, I really care about you, but I don't have a crystal ball. I just don't know which one is going to break first. They're all equally important. It's okay if you pick which one you want to start with, you know, and then I'll tell them some patient story, which are all true. Look, I had this patient, and this is a true story. He waited and waited and waited on these cracks. And the guy, like, it's crazy because he'd come in one day and he's like, hey, guess what? I just wrote a check for $660,000. I bought a house in Florida, but he will not fix this cracked filling, right?
Oh no.
18 months later, he comes in, he needs endo. Guess what he did right after he needed the endo? He fixed the rest of the cracks, right? Because not only do you have poor prognosis because you've needed endo and a crown, you've now spent, instead of $300 for the filling, $3,000 for endo and a crown, you have a poor prognosis. So conversations like that take time. And we now have the time to spend to have these conversations. And you know, you can't convince everybody, and that's okay because you have to give them the space. It's okay. This is your mouth and you get to decide. So we've gone through a lot in going from this, you know, we'll see anybody for 3 minutes and we're seeing 50, 60 patients a day, to I see 2 to 3 patients a day now. That's it. You know, versus you know, there would be days that I'd see 50 patients a day.
Yeah. You personally would see 50 patients.
I would see 50 patients a day. Yeah. I would work 13-hour days sometimes and see 50 patients a day.
What has the change been in your quality of life?
I couldn't, if a patient would call me, I would want to hang up on them. I just could not stand these humans. You know, they were irritating me. I didn't have very much respect for them. I didn't have very much respect for myself. I certainly didn't have very much respect for my work. I didn't take pride in my work. I wouldn't want anybody to see what I was doing, because everything I was doing, I do endo in one room. This is all in an hour. I do an extraction in another, and then a bridge in another in an hour. Right? And now I post pictures of my endo and implants on social media. I love what I do, and I love the humans that I treat. Like I just love them. I can't wait to see them and to take care of them and to serve them. And the more anxious they are when they come in, the more I love them. The more I want to help them carry that emotional burden. And before, if a patient would have come in and they'd be anxious, I'd be like, peace out. Like, I don't deal with psychos, not today, you know? And it's just it's a different life.
Was there something that like, we're talking through the story of the change. Was there something, or was it really COVID? COVID was like the catalyst where you had like some distance to think and you're like, I want to change all of this. Was that the catalyst? Like what ultimately made you be like, okay, we're going to like make this change, or it had been bubbling for years?
I think it was bubbling for years. I had a lot of insecurities. Like, we talk about numbers, and before this podcast, we talked about numbers, and we were geeking out on numbers. If you would have shown me numbers before 2020, I would not been able to stomach it. I was so ashamed. I did not want to look at numbers. And now I love, like my whole face lights up when I look at numbers. But really, it's within that COVID time, that we were all glued to monitors and we were meeting people online, that I met some really cool doctors, some really cool colleagues that have now become my friends. PDA faculty members back then, Chad Johnson, Dave Deal, and they showed me what was possible. And I'm like, holy cow, what if I could be like that? And I never dreamed, Wade Kiefer, and I never dreamed that I could be like them. But if I could just stay around them long enough to at least watch what they do and how they do it, then maybe I could get closer away from who I was at that time and closer to what they were. And never would I ever dream that I could join their ranks. And now we're on a text message where we talk every single day. So I think inspiration had also something to do with that, where it's like, holy cow, that is possible.
Maggie, let me ask this question, because I think there are a lot of people that want to make that shift.
Yeah.
And it's scary, right?
Yes.
There's comfort in being busy, and in a lot of people's minds, busy is productive. I can think of people that I know personally whose practice could do phenomenal without seeing types of patients that they don't want to see. They vocalize to me that they don't want to see them, but in their mind, less busy is less productive. That's a hard shift to make, right? You're going from basically as busy as you can be to intentionally far less busy, more productive, and more profitable. How hard was that mindset shift? And was there ever a point where you kind of slammed on the brakes and like freaked out? What am I doing? I'm getting way less busy. Or did it transition pretty smoothly from, hey, we're starting to phase these people out, and production staying level? I just want to understand that process, because I think there's a lot of people that are kind of stuck on on one side of that chasm and want to get to the other side.
Yeah. And yours is a great story because you did operate for 14 years as like this type of practice. So it's like very easy to believe like you were pretty rooted in that kind of dental practice. And so to like make such a big shift is a big jump. Yeah, I want to hear.
I'll tell you, I still think I'm lying to myself, because I keep saying I want to stay an in-network dentist. And I say that because I want to, and this is the lie. I want to stay an in-network dentist because I want to give an opportunity to everybody to be able to afford me. But I think the lie is that I'm so afraid of how much work it would be for me to go out of network. And I've already made this change, and it hasn't been easy. And one of the things that I say is I went too fast and I burnt out too fast. And if I had to give somebody advice, it would be to go slower. And so I'm still living that dynamic of being afraid. But the advice that I would give to someone who wants to make a decision or wants to move into this next phase of their practice, whatever there is, whether it's, outside of network or whether it's into their implant journey, please, I beg you, whatever the decision is that you want to make, the first thing you want to do is you want to move away from the people that are dragging you down and telling you not to do it. I feel like I had surrounded myself by those people for too long. And the second is now I was lucky enough to be able to afford Productive Dentist Academy, and that had a lot to do with the PPP money. And there's a talk that I give about how I would have been able to afford a consultant anyway because of the way that the practice had changed, and we would have been able to afford it anyway. But if you can't afford a consultant to help you with that transition, find a mentor. And I don't mean, so like people associate a mentor with like, this is someone that's just going to tell me what to do and they're going to be my coach. And no, I don't mean that, because no, people don't really have time for that. I mean someone that you can just talk to and feel inspired by, right? Like my PDA faculty, people that are now my friends that we talk to, just find someone who you aspire to be, strike up a friendship with them, and remain connected to them. And in the moments of doubt, and in the moments where you're like, this has gotten really gritty and really hard, and I'm doubting my choices, reach out to them and see what they have to say. Like, this implant journey has been extremely hard. And I can't tell you how many times I went into my office and just broke down, and I'm like, I need to be helping people and not hurting people. Why are these implants failing? And I feel like nobody really talks about that because we don't want to show our failures. We only want to show our successes. But I have one, Dr. Chad Johnson is that person for me. When I am down and when my implant is failing, I call him and I'm like, I don't think I should be doing this anymore. And within 3 sentences, he will turn me around and empower me, right? You don't need to have a coach and do it an hour session. You just need to have one person that you trust that inspires you to bring you back to center and to tell you, it's okay for you to have these downs. We all have them. We've all failed. You just need to, you need to keep going. And so I think that's where that distinction, that's where that empowerment, that's where that encouragement, that's what oils that's what greases that wheel to keep moving forward. Because we're all going to get through those gritty, difficult moments where it's like, I'm out. I just know it's too much. And it's okay. Take a week, whatever you need to say that it's too much, and break from that. And if it's too much, it's too much. Or like everybody's pissing you off and you've just had it. Like, if I look at my hygienist one more time, I swear to God, like, fine, just walk away, and it's cool. But just have someone that can bring you back to center so you can keep going with those changes, because chances are that you can make those things happen. You can. You don't have to make them happen in a year. You don't have to make them happen in 3 weeks.
Yeah. I actually really love that. You brought up something that we actually had this conversation, when was that, last week? That, with the internet, you can find what to do.
Yeah.
Right. You probably knew the path to get to where you wanted to be. But at certain points along the path, having a coach that keeps you accountable, that you can just have the conversation with, that, when you want to pump the brakes, they say, don't pump the brakes, you're almost there. That can be a huge benefit. Steve, you probably know this, but Steve does a lot of running. I hate running. Steve loves
You and I are so alike.
You guys really are so alike. It's crazy.
Steve somehow convinces me to do 1 race a year, and I hate the whole time of it. But
you love it.
But then I'm really happy after. So Steve just had a goal to Boston qualify.
Yeah.
And accomplish his goal, sub 3 marathon, which would be about what would take me to run a 5K probably. So that's where we're different.
Congratulations.
Hey, thanks.
But the conversation came up because he paid a coach to help him get there. And nothing that the coach gave him was like, oh, I never knew that.
Yeah.
Right. It was just, here's the path. And when you're training, when you're implementing, the coach is there. I know that he's going to follow up with me, and I've got to be accountable to him.
Yeah, I'll just say, like, my execution on the training plan was far more crisp when I knew that there was someone that's paying attention to my effort.
Yeah.
Does that make sense? Like, I trained before, and I'd been training for years, and I'd, made some attempts. I had run like a 3:15 and a 3:17. I'm like 15, 17 minutes slower than I'd wanted to be. And just having someone that I knew was reviewing my training runs, looking at my heart rate, we can compare this to dentistry. But then even like saying the things I needed to hear in the moments when I needed to hear them. So like if I had a hard training one where I'm like, dude, like I don't know if I really am like a sub 3 hour guy. Like I want to lift weights. I'm a 36-year-old dad. Like, am I kidding myself? I've never been a runner until now. And just having someone that will, to your point, like Chad Johnson, Dr. Johnson did for you, someone that will just say the right things to you, you know? So he would just have me repeat like, nope, trust the training, trust the plan, you put in the work. Like you need to tell yourself those things and like just trust time. Like as you keep putting effort into this skill, over time, the excellence will build, and you keep stacking evidences to yourself that no, I can do this thing. And you had this bad training run, but you'll have a good one within a week, and you'll feel strong, you'll finish strong, and just log that away as like another evidence you can lean on. Like, nope, like now I'm getting to the point where I've got hundreds of examples of really strong training runs, a handful of really great races where I'm like, okay, like I'm building the sense of confidence. And I can imagine, Maggie, for you in dentistry, there's similar things that happen clinically, where as you are putting time and effort into it, you've got, Chad in your ears saying the right things, and you're starting to stack these evidences where it's like, okay, no, I can do implants and not have them fail. And I can learn from these, missteps and mistakes and move them forward. I'm a huge fan of a coach. I also just like comment this, like for listeners, this might be interesting. I just was messing around. We have some new ROI dashboards. Basically, as a company, we're just trying to understand the impact that different pieces of dental intelligence can have, but we're also partnered with consulting firms like Productive Dentist Academy. And one of the really interesting things, so in the little dashboard, I can see that the average dental intelligence practice is growing year over year at about 12.5%, which is like awesome. That's really good. It's beating the industry norms for practice growth and production growth. But what's really cool is when you introduce a consultant like PDA, they're one of our like biggest consulting partners. That growth all of a sudden doubles. It's like 24.7% is the average year over year growth when someone's a DI customer, and we know they're working with one of these consulting firms. And so I think that speaks to like the power of having someone that like helps you along the way. You can get above average growth without it, but I think, man, it's so powerful when you have someone with you. So
there's something so special about consistency and accountability.
mhm.
And if we're going to talk about DI, or since you brought it up, Your Honor, if you opened up the door to the argument, that idea of consistency and accountability is within DI. And I'll give you an example to this because I had this hygiene meeting. It was kind of a clinical calibration, kind of a hygiene meeting. And I was trying to incorporate this new thing that we were going to do. And I said, you guys, we got really good at incorporating varnish. And then I look at our varnish, and it's at 18%. And then I'm like, oh shoot, what am I talking about? We didn't get very good at incorporating varnish. And so it really it takes the emotion out of it, right?
Yep.
Because my memory is different than what is actually happening, right? I'm not in the room the entire time. And I'm like, oh shoot, we suck at varnish 18%. That, I mean, risk, when we talk about risk factors and things like that, when we should be recommending varnish, 18% is nowhere near where I think we should be. So let's just kind of go back and talk about risk factors and philosophies, and let's start from the beginning. But these numbers tell such a tremendously powerful story, and they keep us accountable to our businesses and to our growth. Now, granted, life happens, like if our associate ends up leaving, we will have to come up with a different growth plan, and that's okay, right? But these numbers are very important to look at, and they tell an unemotional or emotionally distant story of actually what's happening within your business, and they allow you to project, and they allow you to look back, and they allow you to put into perspective exactly what happens and what's been happening and what could be happening. But they actually also allow you to celebrate, because we are so hard on ourselves, right? And we so frequently pay attention to the things that didn't go well. But sometimes looking at those numbers, we'll be able to say, you know what, that it wasn't as bad of a month as we thought.
That's that's the power of the data that, like you said, is not how are we feeling, and then someone to keep you accountable to that data. And that can be, if you're very good at accountability and putting systems in place, you know, you'll see really, really good success with having all of that data at your fingertips.
And I'm actually even curious, and you probably know this better than anybody, some of the top practices within dentistry, how many of those are tracking their numbers? Right? I would imagine all of them are.
I would assume so. We kind of like, maybe we're like jaded, but we just kind of assume that the highest performing practices are using, dental intelligence, or they're tracking something like, and just anecdotally, and this is really just an anecdote, but Adam and I had the chance to travel the country. I've been to a ton of conferences and spoken with thousands of dentists. And when I look at like the average dental intelligence practice, and what they're producing, I just know anecdotally it's significantly higher than what I hear from the average dentist I'm meeting at a trade show. So my assumption
That's
is
really
that
so
it's like
interesting. I talk from the stage,
by like
and
hundreds of thousands of dollars
yeah,
every year.
and I usually quote that the average dentist, and so I'm wondering what your numbers are. I'm told that the average dentist produces between like 350 and 450 an hour. But I would assume that your DI dentists produce higher than that.
Yeah, I could look at production per visit. I think right now, dentist production per
It's
visit.
per hour,
DI
not per visit.
So, and I'm saying per visit, assuming like over
The
time,
visit is an hour.
roughly per hour, just because I don't have the hour number right in front of me, but the production per visit number is 651 or 621. I can get the exact number so that listeners can rely on me. I just barely
And that's again the power
sent it
of
to
tracking
someone.
the numbers.
Yeah. Like almost double.
Mhm.
I'm gonna pull it up. Now, as I'm pulling this up, I would love to hear from you. Oh man, we're almost up at time. I would love to hear. There's a question that we ask every guest. So I'm gonna go to this. Every guest, we always want to hear from them. The namesake of the podcast is the Growth in Dentistry podcast. And so we ask every single guest the question, what does growth in dentistry mean to you? And I would love to hear from you, your answer, Dr. Maggie. What does growth in dentistry mean to you? And then I'll finish up sharing a couple little stats here.
You
So
could not have prepared me by giving me this question ahead of time.
that I could have 621, by the way, restorative production per
621.
visit,
Okay.
the
Yeah.
average DI customer. And there's like just over 10,000 practices that are in that group. So it's pretty statistically significant, 621. So
Okay.
almost double. I mean, assuming they're somewhat similar numbers, we can do a little math there, but.
What do you mean growth in dentistry for a practice owner, growth in dentistry for the industry?
Up to you, your vision for the industry, yourself, like what does it mean? Anything. It's a very broad question.
It's a very broad question.
For great answers.
I think that we have some rethinking to do. We have a lot of young people that are graduating with a tremendous amount of debt, that are going unfulfilled in this profession, that are going uncarried, unsupported in this profession. And my heart goes out to them. And at the same time, I'm wondering what will need to change in order for them to feel supported. For me, this profession has been a godsend. I am on a high. I am in flow when I am in the patient's mouth. I could not be happier to have somehow arrived at this point. I cannot stop learning, and I never want to stop using my hand. I don't want to hang up the handpiece until my body forces me to do that. And to understand that there's such a stark difference between someone that might be graduating from school today with a tremendous amount of debt. For example, like I graduated with $150,000 in debt. And, maybe within the first few years, I made that in that year. So maybe year 3, year 4, that's what I took home.
Yeah.
Today they're graduating $500,000 in debt. I don't know if they'll ever take that home. on an annual salary. And so
Mm.
just to see the difference between where I started and where I've come in dentistry and where they're starting and what their potential is in dentistry is somewhat disheartening. And so I pray and I hope that we can come together as a profession, and not just dentists, but really our entire profession, to find a way to somehow create a solution for the patients, for everyone involved, whether it's DI, whether it's the salespeople, whether it's the CBCT machine manufacturers, for all of us to just make this a more cohesive place to exist and thrive. So it's not just about the dollars. So, and maybe I'm the only one that has that understanding, being on social media and on the boards there. It doesn't seem like I'm the only one that kind of thinks that, but that's what makes me worried about it. I have been tremendously lucky in this profession, and I just pray that everybody else is as lucky as I have been.
I agree, and I pray for the same thing. That's such a fantastic answer. So thank you, Dr. Maggie. And thank you for joining us today. I know it's a sacrifice to take, 45 an hour out of your day to come and record this. So I know that the listeners will be super grateful. This has been just a packed episode with tons and tons of great takeaways. So thank you again, Dr. Maggie, for joining. And for those listeners, thanks again for joining us for another episode of the Growth in Dentistry podcast. Keep growing, and we'll talk soon.